Hello, I'm Robert Sharetta, and this is International Investor. As you can see, I happen to have my personal protection equipment on today, but since there's no one else in the studio, I think we can afford to go without it. Yes, we're deep into the summer of 2020, and of course, we're enveloped in the COVID-19 catastrophe, which has been ravaging not just our nation, but indeed the world. In this particular program, we're going to examine one aspect of the health and welfare of America, which has become all the more critical because of this pandemic: mental illness. The coronavirus, which originated in Wuhan, China, made all the underlying weaknesses of the U.S. healthcare system more transparent and has shown how many people are particularly vulnerable in our society because of conditions or disease which compromises their immune systems. But it is also taking a toll on the mental health of people. In my observations, it is becoming increasingly apparent that a considerable percentage of my fellow citizens face serious emotional and mental problems which impairs their ability to participate in the workforce and as ordinary citizens. According to the figures that we put together, the number of people who have had mental illness issues is quite significant. And again, that includes many different subsets of Americans suffering from occasional depression to more severe cases of schizophrenia and other psychic and sometimes dangerous disorders. Just look at these stats. And then there's the opioid crisis. According to our numbers, over 47,000 people died taking opioids in 2017. All of these people are in our nation's schools, in our workplaces, and on our nation's highways, complicating the lives of those who encounter them. The consequences of many of these activities can be fatal. We know there are many alcohol-related deaths on the highway each year, but what might be just as traumatic for a large number of people are the number of highway casualties, people injured or even having their car involved in a serious collision, which can require months, if not years, of rehabilitation and can be financially devastating for the families and add to their mental stress. And that's just for alcohol. Now we add to that the number of people who are impaired by all these other pharmaceuticals. If we extrapolate, we can see that many millions of Americans are impacted each year. Then, of course, we have to look at suicides recorded. Look at the figures from the opioid crisis alone. And we're seeing suicide rates rise across all spectrums of the population, from young to old. According to the figures that International Investor has put together, the number of people in total that have had mental health issues is extremely large. For example, there are growing rates of autism and schizophrenia, which now affects sizable numbers of young people. And let's not forget those who served in our military, particularly those who are returning from all the wars. Post-traumatic stress disorder affects nearly 1 in 3 servicemen and women. And aside from the deaths and injuries they could sustain, there are other tragic consequences, such as the fact that almost 40% of the women serving reported that they have had some sort of sexual abuse during their time of service. And suicide rates among the service members are extremely high. And there are other kinds of mental illness problems which impair people's ability to function in our society. Gambling is another example of an addiction becoming a serious problem for a certain number of people. Approximately 2 to 3% meet the criteria for problem gambling. That's around 6 million adults, and 500,000 are teens. And then there are the addictions and neuroses, which may be just as disabling in the sense that they interrupt a person from fully functioning efficiently, and they can damage a patient and his and her family. Well, we get a chance to interview someone who deals with these addictions firsthand and is the officer of an organization that tries to assist people suffering from these afflictions. Let's go to that interview now. We're fortunate now to be with someone who is really focused on helping someone with mental illnesses and particularly addictions in her career. She is Dr. Denny Cariz. Doctor, thank you for joining us. I just want to point out to our audience, you're an adjunct clinical assistant professor at the University of Pennsylvania, but more important for our audience here today, you're the Chief Scientific Officer of Recovery Centers of America. That's an organization that I know tries to help people specifically with all kinds of addictions. Am I correct in saying that?
You are correct, but we also treat mental health disorders as well, and about 60% of our patients have mental health disorders.
Okay. Now, I know also that your particular organization, you're looking at addictions specifically. There are many forms of addictions. A lot that we think about, of course, because the opioid crisis was so devastating to America and still is. These things still go on despite our attention on COVID-19, correct? But more importantly, you deal with alcoholism and many other kinds of addictions. Maybe you could just list some for our audience so we start to comprehend how many different kinds of addictions there are.
Well, the substance use disorders is any addiction to a substance, and that can be drugs, alcohol, any type of drug. It can be a prescription drug that is abused. It could also be sugar. It could also be a gambling addiction. So anything that becomes a compulsive behavior that kind of takes over your life to where you miss social engagements, you spend money you didn't mean to spend, you have troubles as a result of it, that is when it turns into an addiction.
Okay. And, you know, we're going to put some numbers up on the screen as we speak about just how many Americans suffer from these various ailments. You don't think about it. I remember years ago they used to say, oh my gosh, there's 10 million Americans suffering from alcoholism. But as the population grows, of course, the numbers grow exponentially. And if you start to add each one of these addictions, you start to recognize it's a significant portion of the U.S. population has these ailments. And we haven't even talked about all the other kinds of mental illnesses there are. Am I correct that is there a number that clinical psychologists say, you know, in a lifetime, how many Americans might suffer? What's the percentage?
Well, I don't have in a lifetime, but I can tell you right now that about 8.6% of the population struggles with an alcohol or drug substance use disorder. But if you're in the age group of 18 to 25, that bumps up to 16%.
Wow.
So 16% of 18 to 25-year-olds. And then of the people, all of the people who struggle with an addiction, about 60% also have a psychiatric diagnosis, whether it's depression, bipolar, anxiety.
And, you know, you start thinking about this, you see it firsthand in the healthcare profession. I really started to get curious about this issue when I was talking to people in law enforcement who said they're encountering people, it's not alcoholism, it's not marijuana, but they're finding people on prescription drugs are having difficulties driving and doing a number of other activities, and they have to sometimes confront them. It makes life more complicated for everyone, but also for educators, also for people who are trying to help young people in a vast number of activities, their sports coaches and others, understanding that, hey, maybe 1 out of 8 children that I'm dealing with has this kind of issue, would cause one to say, you know what, I better be more careful and recognize myself that this could be an issue with the child that I'm trying to either discipline or give instructions to. Am I?
Yes. So you have a large school and a sports team of 50 students. Then you're probably looking at about 8 or 9 that have some level of a substance use disorder.
Okay. And for educators, a big issue. You know,
yes.
You know, whether you're running a university or a high school, you're saying to yourself, boy, we need extra counselors for this. We really need people who can recognize these issues and help, especially because we still, I'm sure you know this better than we do, it's not something that people want to readily admit. And we haven't even talked about all the if it's 16% of young people in that age category you mentioned, how many family members? We're talking probably times 4 or 5 maybe for family members who are affected, because it may not just be their nuclear family, it could be their grandparents and others that have to understand how to cope and help these children, these young people.
Yes, and these numbers, the result of COVID, see, COVID started out as this acute stress. it is now a chronic stress. And sometimes that's more difficult than an acute stress that you feel will have an ending soon, right? So everything has gone up. Suicides have gone up. Child abuse has gone up. Domestic abuse has gone up. Relapse to drugs and alcohol has gone up. The number of people who are drinking very heavily all have gone up.
Wow. And you know, I can see why. I mean, you talk to, quote, people who don't suffer from mental illness, or at least that means they haven't been clinically evaluated yet. I can think of many in my life, but it's stressful for all of us. I mean, it gets aggravating here. I just took a mask off. You saw me wearing, you know, we're constant PPE. I have gloves on now, even in this studio situation. We're all trying to protect each other. It gets aggravating for people. I've seen people losing their temper a little bit more easily than they should. And we're all bombarded constantly by negative news, morning, noon, and night now. You know, the COVID figures are the first thing you wake up to in the morning, with how many people died and how many were infected yesterday in your state, your city, your town. I'm sure you see this on the clinical level.
Well, we actually do. In fact, in a study of people who were in recovery, about 20% of people in the first couple of months started using drugs and alcohol again. 20% had either an overdose or somebody they know had an overdose. The overdose death rate was going down in 2018-19, and now has gone back up, which is very. And if you look at people who don't even have a disorder necessarily, what's so interesting to me is that traffic patterns in Pennsylvania, for example, are down about 35 to 45%. So there's 35 to 45% less traffic, but there's just as many DUI arrests as when there was full traffic.
Interesting observation. Yeah, and I understand just as many speeding, if not more speeding tickets, because people are driving very recklessly on these almost empty roads at times. Who knows if that's another sign of frustration, perhaps. Or stress, you know, I've got to get from point A to point B to get my prescription or to get, you know, something else in my life. It does occur to you that also isolation has got to be part of this. It's not just people in cities, but people in suburbs, the countryside. Before, they could always say, okay, tomorrow night I'm getting out, I'm going to see my friends, and we're going to get together and have a few drinks and meet some, you know, who knows what strangers we might also encounter to make our lives more interesting. Now, a complete shutdown, that has got to weigh heavily on people who are already troubled.
Yes. Not only does the isolation of not getting out there to socialize kind of weigh heavily on people, it makes people feel very alone in the world. They don't have the support they had. But it's also, in addictions, there's this kind of secrecy about it. So people can stay home and drink, whereas if they were out there and going to support groups or whatnot, people would be asking, how you doing? When was your last drink? They don't have any of that, so they can really hide it. So not just have people in recovery from addictions had relapses, but also people who never really had a problem, they're at home, they're isolated, they're drinking more as well. In fact, sales of alcohol went up 55% in March.
55%. I heard they went up. I didn't realize it was to that degree. But let's talk a little bit more about isolation. You know, isolation in the past might have been a farmer and he had very few ways to communicate. Now they go to the internet, they go to their mobile phones. That becomes an addiction problem in itself, does it not? And let's face it, let's talk about the dark side of that, which is also these deep rabbit holes of political or other extremes that people might go to, especially when they're alone, especially when they're under stress, especially if they feel like they're unloved and unwanted. And also pornography. Let's face it, that's another. Do you deal with pornography and internet addictions?
Some people have that along with drug and alcohol addictions. It's not uncommon, so we address that as well. In general, we would address anything where somebody's behavior has led them to, do something in a compulsive way. They can't quit on their own. They're having trouble with it. It's hurt their family relationships. It's hurt their work relationships. They will stay up all night long, even if their parents put them to sleep. And I'm talking high school and younger. They will stay up all night long on the things till their fingers bleed. that is actually was kind of the deciding factor, the studies of those kids that led them to think of putting that in the diagnostic manual in the last revision, was that these kids' fingers were bleeding and they still kept playing.
Well, let's face it, COVID-19, if anything, it's also adding to people's financial stress. The number of people losing jobs is astronomical. The number of people who are going to be taking jobs, but jobs maybe they hate, and maybe it's just part-time, and maybe it's not something at all that they want to do. People facing evictions, but more importantly, people just draining whatever savings they have. People worried all night long, and if they have family members, adding to that dynamic too, where they're arguing back and forth. This has clearly got to also build the stress in everyone's life.
You know, it really does. And when I was in my early 20s, I actually got into recovery myself. And if I look at how I'm doing now, I'm doing okay. But back then, I was going to community college where I got like really intellectual, stimulation and a social experience. I was attending support groups. I was newly sober. I had a great expansive support groups. And I was waitressing where at the restaurant I made my money and I got more social kind of supports. If this had happened then, I would have had no social support. I would have had no money. I would have lost my apartment. I would have had no place to get support for my recovery. I frankly would have been devastated. And we got to think back. The average American does not have even 2 months backup financially.
That's right.
The deal is 6 months or a year. The average American doesn't even have 2 months to live without a paycheck. And it's really a frightening time for people.
Well, that's where I want to bring this conversation to, because I started by mentioning the number of not just institutions, but facets of life where all of us have to be a little more tolerance and patience when you say to yourself, hey, yeah, that guy just cut me off on the road, but maybe he's one of the 8 that's having other issues. Or, this lady that's really screaming in the store has other problems that we should all be a little bit more mindful of. And that's on a personal level. Maybe we should all kind of take that. But professionals should also, I think, be thinking more about it. Because I don't think everyone who's not in healthcare, and by the way, I should have said at the outset, thank you for your service in the healthcare field, but I think especially in the mental health care field, you're not getting enough attention and credit yet, because this is a big problem, and I think it needs a government response that we have not yet seen. Am I correct in thinking? Is there something that you would like to see both state and federal government be much more proactive in helping?
Well, yeah, I think they need to make it easier for people to get into treatment. I also think that they need to extend some of the things, like we've been able to add telehealth services, and that is only because of the Disaster Relief Act that we've been able to get paid for telehealth services when somebody can't come into the meeting. Previously, that was only really utilized in rural areas, and you actually had to go to your doctor's office and do telehealth from there with a doctor at a different place. Now, we can provide and do provide individual and group services, treatment, counseling, guidance, peer support via the internet, whether it's Zoom or whatever, and be able to bill for that. So that has to actually continue for a while after this as well. But I think the important thing, what you're kind of getting at too, is that under stress, everything kind of gets a little worse. So if you are a little depressed, if you're a little paranoid, if you have trouble with anxiety, if you have bipolar disorder, even if you have diabetes or hypertension or asthma,
That's
stress, all of those things worse. And this is an incredibly stressful time. One concrete recommendation I would have for people is turn the news off. Don't look at the news more than half an hour a day. Don't spend your whole day listening to the news. It's just going to make things worse for you.
Yeah, no, I agree with that. Even if it means they have to miss International Investor once in a while.
I don't know about that.
But no, it's fair is fair. I myself am too much of a consumer of news, and I find myself at the end of a long day, boy, do I want, I sometimes, I'll say, let's shut it off. Let's get to another, I want to see a comedy,
Yeah.
Give me something really benign. Go ahead.
When this started, I started doing Facebook Live episodes. So every morning at 10 a.m., I do a recovery reading. It's about 20 or 30 minutes, and I talk about an aspect of recovery. I was also doing at 4 p.m. an update on COVID and the numbers. And after about 10 weeks, I just could not do the COVID update anymore. I mean, I always tried to, I tracked the numbers and I ran numbers myself. And I always tried to end with something like one of the great songs that came out about the COVID experience, those funny songs, or some of the neologisms about quarantines and COVID divorce and COVIDiots, all those kind of funny things. But even with trying to add that, it just became too much to do every day to track all these things and report on them. I sometimes wonder how reporters are doing it that do it every day for a living.
And you can get away with it. You probably know this better than anyone else. You can hold yourself together for only so long. You can be a tough guy or a woman for a long time, but there comes that point where you say, enough's enough. And
Yes.
it used to be, I worked on Wall Street for a long time, that I would say, time for a vacation, Robert. You're starting to, really get aggravated all too easily. And I would book 3 days somewhere and just, get out of town. You can't even do that easily now. So, and for those who can afford it, but the complications of just trying to travel has just become even worse. So we're in a tough spot. The reason I wanted to do this show is because I wanted to impress upon people that not only do we have to be all more tolerant in a personal situation, but we really have to be more thoughtful as a society if we're going to get through this, not create a lot more mental illness, and at least alleviate it for those who are already suffering from these phobias. That's why I'm so thankful for people like you and your organization. I mean that sincerely. I really hope we continue to put your website across the screen, because I want people to be able to contact you guys to really try to receive help, and also family members who know that there might be somebody in their family that can use it. But the final question I have for you is, I know it's been a long-term problem, and that is the stigmatism that comes with mental illness. Is there any way we can get over that? Sometimes I see stickers on people's cars like, my son is on the honor roll in such and such high school. And I almost feel like I would love to see a family member be strong enough to say, my son suffered from mental illness, but with our help, he's doing fine now, or something. That kind of bumper sticker. But I don't think we're there yet, because people feel like, it's not something I really can brag about yet, even if I'm doing the right thing.
Yeah, I mean, I think that's one reason why treatment is so important, right? Because it's very interesting. If you look back at cancer in the 70s, and then you look at TB, and you look at AIDS, those were all very stigmatized illnesses. And the stigma really started to drop when they hit what we call a 30% penetration rate. Penetration rate is a percent of people with the disorder who get treatment, not who get well, who get treatment. Okay. So when you hit that rate, we're at a 10% rate now, and 10 to 12%, and we've been there since 1980.
Then the government's got to do a much better job. The federal government and state governments, but it's got to be federal government now, because the states are all going to be running broke after this COVID-19. And I'm going to leave with this note. If we can all now pressure ourselves to put these on and to live with PPE to get over this COVID-19, then we sure better try to address the mental health issues of the nation too, and try to give people the benefit of the doubt when you encounter them. I actually think the police and your profession are ahead of the curve when it comes to thinking about these issues, at least. Educators probably also, but there's a lot of other facets of society where we really need to think more carefully about, let's try to help people out that we encounter who obviously need help.
Yes.
So I want to thank you for your time today. That's all we've got now, but you've been a great help just to explore this subject, and I really hope your organization continues in the future and grows and gets the federal funding necessary to make it grow even more. So thank you.
Thank you.
Well, our guest gave us some great perspective on the vast numbers of people who are troubled with mental illness and what their family members go through. It is clear that our government, at both the federal and state levels, could and should be doing more to fund these organizations which are trying to help these people and lift them out of their distressed states. It would prove to be the least costly alternative for our society. But there is one other worrisome rising trend in our nation that can also be a consequence of mental illness, if it's described that way: gun violence. The annual rates of suicide and murder by firearms is quite alarming, and as we have seen across the U.S., gun violence and deaths are rising rapidly this year since the COVID-19 virus arrived. And although the deaths get immediate attention, a far greater number of people are shot and injured each year. Take a look at these numbers for the dead and wounded. But the biggest revelation for me is the accumulative effect of all these traumas. We have totaled up some of the numbers and conclude that at any given time, even before COVID, vast numbers and a significant portion of our population suffers from one or more of these afflictions. Although we have been looking at annual numbers of deaths, injuries, and afflictions over time, many people experiencing these conditions never forget them. And it's clear that when a mother or father gets shot or is in an automobile accident or is traumatized in any way, the entire family suffers the consequences financially and mentally, sometimes never fully recovering. At International Investor, I want to say that these revelations and numbers should really make everyone pause and think about our own family, your neighbors, your community at large, perhaps with a little bit more sympathy and understanding of the experience of others. You know, it has wide implications for our society. They will determine how much education someone receives, how effective they are in the workplace, what kind of citizens they become. Well, that's all we have time for now. So we're International Investor. I'll say goodbye and good luck.